I think it's important to still say that the vaccines work, and we should not be saying the vaccines don't work. That's why I want to talk about vaccinating the unvaccinated people. Out of over 800 people who got exposed to SARS-CoV-2, there were 3 hospitalizations and they got released quickly. There were no deaths. This is an amazingly effective vaccine at preventing severe disease, hospitalizations, and deaths. That was actually the promise of the vaccines. It was always why we designed the vaccines. Otherwise, there would not have been a design of a vaccine against something that did not cause severe disease. So I want us to remember the message of this outbreak. The second thing that we learned from this outbreak is that the Delta variant is very transmissible and that it has high viral loads. And what that will do is that it can lead an vaccinated person, even before their B cells, what are we called memory B cells, produce the antibodies that get into their nose to stop that infection, that can cause more mild symptomatic breakthroughs. And because of that, the CDC's recommendation in areas of high circulating virus to wear masks indoors, even for the vaccinated, is very reasonable, because this will prevent the vaccinated from getting mild breakthrough infections. But the third thing from that report that is very important is we cannot conclude that vaccinated people are equally as likely to transmit as unvaccinated people. This was based on what are called psychothreshold tests of PCR values, but they have not done culture tests, they have not done serial viral loads. Presumably what's going to happen is a vaccinated person is going to fight that virus, bring it down in their nose. So any conclusion from this that vaccinated people are equally as contagious should not be made. So I really want to put that report in context. These vaccines are still working. They do work, but for right now, because the Delta variant is transmissible, putting back masks for the vaccinated indoors is very prudent. Vaccine mandates have been opposed in this country because it seems to speak against people's right, they say, to control their own healthcare. However, this is a public health issue. And what happened in 1905 is that, and I really want to stress this, is that there is a ruling from the Supreme Court of the United States that vaccines can be compulsory. Why? Because there was a smallpox epidemic in the United States in 1905, and 30% of eligible vaccinees did not take the vaccine. So there was a case called Jacobson versus Massachusetts that was presented to the Supreme Court. And there is a Supreme Court ruling in the United States that it is legal and ethical to mandate vaccines for public health crises. You are now seeing the effects of that ruling. You are seeing that state employees in California are being asked to vaccinate or have repeat testing. President Biden will be announcing that and has already indicated this today for federal employees. Third is public-facing employees are mandated to be vaccinated in San Francisco and New York City and in Santa Clara and increasing cities around the world, around the country. Number 4 is that we are mandating vaccinations for healthcare workers in most settings. And that is any healthcare worker should be vaccinated against this virus.
So I was saying that we're tired and everyone really wants to get back to their new normal. And so in the setting of this fatigue from the social losses and the physical losses from COVID, with that is coming a lot of finger pointing. And we've even had some politicians explicitly say, it's time to start blaming the unvaccinated folks as this pandemic worsens. And so while my goal is similar to others on the call and to others in the community, that we want to get every eligible person in the community vaccinated, it's really a lot more nuanced than just pointing the fingers at the unvaccinated as we continue to see spikes in COVID. So first, when we think about the unvaccinated, it's important to acknowledge that this group is not a monolith. So I'm a pediatrician. I work in a pediatric emergency department. And so it's important for me to acknowledge that children under 12 aren't even eligible for the vaccine. So we can't just blame, the vaccine hesitant, because there are some that are legitimately not eligible to get the vaccine. We've had over 4 million children test positive for COVID, and we're seeing increasing rates of COVID among this population. And then I'll also just say, as we point fingers into the community, and particularly communities of color, about not being vaccinated, we also need to acknowledge that there's still many healthcare workers who are not vaccinated. I think the last data that I looked at, less than 50% of nurses were vaccinated. So while we need to double down on our efforts in the community, we also need to double down on our efforts within our own healthcare system to try to address what are some of the gaps in getting our own workers vaccinated. Because why should the public be expected to trust the vaccine if their nurses aren't even taking them? And then finally, what I'll just add is that, shame and blame is not going to help us address the issue of the unvaccinated. Instead, it's really important that we take an approach of empathy and perspective taking. We are going to need more trusted messengers who are going to be healthcare providers like myself, as well as the barbers and the pastors in the community, so that we can meet people where they are to help identify what their barriers are and to help address the barriers that they have when it comes to getting vaccinated.
All right. I think in looking at studies and variants, everyone would like to get a definitive number. I am this exact percentage protected. That number does not exist. Each of the studies is different, and each of the studies has some fairly strong points. Some are larger, some are smaller. I'm going to try to sum everything up here, but the best summary is exactly what Dr. Gandhi said and Dr. Johnson said. The vaccines are safe and they work, and you probably ought to get one if you don't have one already. At a population level, an 80 to 90% effective vaccine is an absolute godsend that would be extremely effective at ending a disease like COVID-19. I know the CDC has been, and other people have been, comparing the infectiousness of the Delta variant to other viruses. And what they're comparing those against are other viruses back before we took any precautions, like chickenpox, when people had chickenpox parties and were deliberately trying to spread it. And right now, Delta is the only thing in the world that is spreading. Measles is way down. Influenza did not have an influenza season in America this year. And chickenpox cases are also down so far that most states do not even track and report them anymore. So, yeah, this is a reasonable case for the most infectious virus that we know about, I think, on a just molecular biology level. The fundamental problem here is that vaccines are given on an individual level, and individuals tend to see an individual benefit as the main driver. Vaccines do work through immunity on an individual level, but in the big picture, vaccines essentially work through mathematics at the population level. And so while a vaccination will help anybody who gets it, and this is what these studies that I'll talk about show, there is a bigger prize here, which is that we get to end all of this nonsense with COVID going around endlessly.